Prescription drug misuse and abuse is an urgent and growing threat to our nation as well as to its citizens. According to a 2013 survey, roughly 6.5 million people ages 12 and older are current non-medical users of prescription drugs. As recently as 2011, more than half of the 41,300 unintentional drug overdose deaths in the United States involved prescription drugs. And opioid pain relievers were involved in nearly 17,000 of those deaths. Nearly 110 Americans died every day that year from drug overdoses. Now, as we've learned from scientific studies, treatment providers, victims, and investigations, prescription drug abuse can easily lead to the abuse of heroin, an addiction that has become increasingly lethal. In fact, in the decade from 2002 to 2011, the annual number of drug poisoning deaths involving heroin doubled, making prescription opioids and heroin some of the most lethal substances in common use. Now, these shocking statistics illustrate that prescription drug addiction and abuse represent nothing less than a public health crisis. And every day, this crisis touches and devastates the lives of Americans from every state, in every region, and from every background and walk of life. The Department of Justice has taken aggressive steps to fight back by targeting the illegal supply chain, by disrupting so-called pill mills, and by expanding public health, education, and law enforcement efforts. But we also recognize that much of this work must start at home. Nearly 4 in 10 teens who have misused or abused a prescription drug have obtained it from their parents' medicine cabinet. That's why today I am announcing that we are expanding drug take-back efforts by introducing new ways for people to safely dispose of old or unused prescription drugs. Through new DEA regulations, patients will be allowed to more easily join the fight against prescription drug abuse by dropping off their leftover medications at pharmacies, hospitals, clinics, and other authorized collectors. Beyond authorizing new drop-off sites, the new DEA rule will allow long-term care facilities to assist in the disposal of prescription-controlled substances belonging to current or former residents. And most importantly, patients or their family members can mail their prescription-controlled substances to an authorized collector using prepaid mail-back packages that can be obtained right from their pharmacy or from other locations like libraries and community centers. Drug take-back programs on a more limited scale have already proven to be effective. At a drug take-back event last April, Americans around the country turned in 390 tons of prescription drugs at nearly 6,100 sites coordinated by the DEA and more than 4,400 state and local law enforcement partners. Over the last 4 years alone, the DEA and its allies have taken in over 4.1 million pounds. That's more than 2,100 tons of prescription pills. Once collected, these medications are then responsibly destroyed to ensure that they don't damage our environment by ending up in landfills or in the water supply. With these new regulations and with continued take-back events like the next upcoming event that is scheduled for September the 27th, we hope to increase those numbers and prevent more potentially harmful medications from being misused or abused by young people and others. Now, as a lifelong member of America's law enforcement community, as a former judge and U.S. attorney, I have seen the devastating consequences of prescription drug abuse firsthand. And as Attorney General, but most importantly as a parent, I am committed to ending the national epidemic that has already stolen too many lives and torn apart too many families. I thank you for your help and your partnership in ensuring that we can continue to save lives and protect the futures of our young people. For more information, please visit the DEA's website at dea.gov.